Well, thank you so much. I'd like to thank the Academy for inviting me here, and I want to give you guys the lowdown on stem cells and PRP so that you can go back to your offices and do these. A lot of material to recover, so I'm going to sort of have to talk like an auctioneer to try and get everything done. But anyway, what we see here is what I call the Holy Trinity. We have to have growth factors, we have to have scaffolds, we have to have stem cells. Without these things, things aren't going to work. So we're now looking at a new dynamic. I've been here for many years, but I'm now treating my patients with injections. I still do some surgery, but injections are really working well. These are regenerative injections using PRP, stem cells, etc. Now, we're going to talk first about platelet-rich plasma. And one thing about this is a great slide that I have, I think. The more we know, the more we don't know. So you guys are going to leave today knowing more things, but really knowing less things. But what do we kind of know about PRP? Well, basically, this is a slide of peripheral blood. We see most of it is obviously red blood cells. But we also know that there's some platelets here, and there's also some white blood cells. Now, here's a PRP, or platelet-rich plasma. Mainly, we have the platelets.
So we're going to talk about something that's actually dear to me, mesenchymal stem cells for the treatment of arthritis. Let's talk about arthritis, which several people, unfortunately, actually suffer from. Too many people actually suffer from this. And as you all physicians know, it involves the breakdown of cartilage. There's surprisingly over 100 forms of arthritis. Oops, there we go. Sorry about that. Arthritis actually affects over 37 million people, 1 in 7 actually in the United States, and over 67 million people are actually will be affected by the year of 2030. The interesting thing about arthritis is that the costs of this actually are staggering. It's costing us approximately $128 billion in medical care. Presently, there's no cure, as you all know. The present standards are basically cortisone therapy, anti-inflammatories, analgesics, small biologics, surgery, physical therapy, and all of these are actually described as basically
How's everybody doing today? I'd like to thank the organizers of this that allow me the opportunity to speak about cryopreservation and culture expansion of stem cells. So the objective of today is to review guidelines defining mesenchymal stem cells, discuss challenges of standardizing cryopreservation techniques, understand the importance actually of banking your stem cells for future use, and analyze methods of mesenchymal stem cell culture expansion and their implications in patient treatments. How many people here think that stem cells are the future of medicine? You know, you'll be blown away to know the simple fact that monoclonal antibody production was brought in about 35, 40 years ago. And not until 2008 was this over 25 years for this to get actually penetrated into the market. The market of monoclonal antibody production now is valued at over $50 billion after 30 years. So it's a pretty amazing fact, and I'm sure the stem cell field is actually going to surpass this financially. So as you all know, adult stem cells, you're able to isolate these from various tissues. These cells must be able to self-renew. They have to have potency, meaning they have to be either unipotent, multipotent, or pluripotent. They have to be able to differentiate, meaning they have to be able to change into all these different specialized cell types or tissues. And the ones, as far as what we're going to speak about today, are adult stem cells from hematopoietic stem cells, which are blood stem cells.
So welcome, and this is the stem cell section of the 23rd, and I can't believe it's been 23 years already, Congress of the Anti-Aging and Regenerative Medicine. So welcome, and we have some renowned speakers this afternoon that I'm privileged to share with you. Our first speaker is Dr. Robert Saxton, and he's asked me to shorten his bio significantly because he's just achieved so much in his career. I wasn't sure where to start, and simply state that he is a professor of medicine and dermatology at the Harvard Medical School. So we welcome Dr. Robert Saxton, and he's going to share some really innovative technology with you.
Well, thank you all for coming, and I want to thank Dr. McCoolin for the opportunity to present information today related to stem cell therapeutics. And the first slide really captures an important message that I want to relay to everybody in the in the audience, and that is, as a bone marrow transplant physician, it was my intention to enter medicine to cure, and so we can't really see it because it's behind this curtain over here, but my intention had been to present options that would be curative to my patients. And so with that, I want to talk to you about stem cell therapeutics, which I believe is the true curative intent therapeutic that we offer our patients. To begin, I have to make a disclosure related to my position as a professor at an academic medical center. Under the NIH guidelines, the technology that I'll be presenting today has been returned in terms of rights back to me as the inventor. So I just want to let you know that I actually own the intellectual property related to the topic today. And that I also serve as a consultant for two companies, Da Vinci Biosciences, which is based in California, and Mesoblast Limited, which is based in Australia. So with that, I just want to start by sharing with you a cover article that was in Newsweek in 2010. It was actually a double issue. And if you want a copy of this article, please contact me. But essentially, this article laid out why there's a gap between what we can do in the laboratory and what we actually give our patients. And my story was part of the inspiration for this article, and it's a very interesting story about what the gaps are and things that can go wrong before you can get to patients. So maybe at the end of this, when we do the question and answer period, we can go into it in greater detail. But I think everyone in this room would have hoped to achieve, if they're not already achieving, cure for their sick patients. And we have some opportunities to do that, I think, in this generation of medical practice. So we'll talk today about stem cell therapeutics. So what is stem cell therapeutics? Well, basically what I say when I talk about it to the medical students, it's regenerative medicine which seeks to improve the length and quality of life by restoring, maintaining, or enhancing tissue and organ function. Now, this is not a new idea, actually. If you go back to the Greeks, very earliest records of Greek medicine, the reason that the rod of Asclepius is the symbol of medicine going all the way back to the 1st century BCE is because the Greeks realized that the skin of the snake could be rejuvenated or regenerated, and what they thought was the most applicable and elegant form of medicine would be that which would allow a patient to heal him or herself using the body's only and sole mechanisms of repair, so within harnessing the repair systems of the person, him or herself. So that's why the snake is there, intertwined around that staff. However, in 1902, the medical corps of the army decided that since one snake is good enough for the Greeks, two snakes are better for the Army Corps of Medicine. All right, so they came up with this symbol, the caduceus. But what they didn't realize was the caduceus is also a very old symbol.
I'll try to make this more practical, things you can actually use. You're going to hear people speaking about things they did. And we'll start right away that the title of this lecture is Repairing Joints and Spine Without Surgery. My name is Peter Fields, and just my office is in Santa Monica. All the literature's out there. You can find it. We'll start right off just a little. She told you that I'm both an MD and a chiropractor, so very uniquely degreed and full board certifications in both, and I teach at a medical school as well as a chiropractic school. So, what controls joints? And I know many of you are in sports or orthopedic medicine, and many of you aren't. Some have been out of school just recently, and some have been out for many, many, many years. So we just go over the basics here, that what controls joints are ligaments and tendons. So you can see over here on the right side of the screen there, skeletal muscle binds to tendons, and tendons control muscles. And on the other side, there are no muscles, so those are ligaments. So ligaments stabilize joints, and tendons move joints, mobility and stability. If you affect...
Better understand the way in which we are essentially aging. Again, thanks Bob for this invitation. This picture is taken at the airport of Tajin, and I met him, he was trying to plug in his cell phone. I was a bit confused because he was just trying to find out which was the right wire to plug in, because there were hundreds of them. So I'm coming from Modena, which is right between Milano and Bologna, very close to Florence. And as just said, Modena is famous for the balsamic vinegars, for the Pavarotti, and for the Ferrari. And I have to disclose that I don't have, unfortunately, a Ferrari, and I don't have any other disclosure to make for this presentation. So, what are stem cells? This has been said, so I'm going to go briefly about this. And these are cells which are incapable to do anything. So you'll be disappointed for that. But that's the reality. It's the cells that by themselves, these guys are not capable to make anything if you don't provide their specific signal that are allow them to make something. And this something is called differentiation. So they can become muscle cells, they can become insulin-producing cells. This phenomenon is called differentiation. And which are the factors that are driving this differentiation? Well, there are many. And generally, there are external factors which are telling the cells to do something. These are chemical signals which are secreted by other cells. This could be like physical contact, cell-to-cell contact, which are telling the cells to do something. And then there are certain molecules that are included in the microenvironment, which are certainly capable to address that specific need of our body. So this is why we are standing up. This is why we are producing blood. And this is why, essentially, we are living. Because at the end, we are like stem cells. You know, we have different type of potency. We have totipotent cells, which can actually reproduce the whole body. We have pluripotent cells, which are more and more committed. And then we go down to multipotent, and then oligopotent, and then to terminal differentiated cells. And this is what we are actually doing in our life, because when we're born, we are capable to do anything. You know, it's everything you do. It's learning, is a learning process, and when we learn, we are committing ourselves more and more till we become, you know, doctors or become lawyers, and that's very similar to what's going on in the stem cells. Also, has been also reported that.
So musculoskeletal disease. I want to talk to you first about this concept. We've been talking about it a lot today, but what I want you to realize is how relevant this problem is in America. 1 in 5 people suffer from musculoskeletal disease at some point in their life. And as you guys know, back pain is one part of musculoskeletal disease, and it affects, you know, over what, 65 million people annually, and costs about $30 billion a year. Total musculoskeletal expense to our healthcare expenditure is about just under $130 billion a year. So this is a big deal. When we talk about musculoskeletal diseases, I want you to kind of put your head in context of what kind of things we're talking about. We're talking about diseases that may be chronic, may be acute, diseases that include injury to bone or muscle or ligament or cartilage or joint, nerves, okay, and spine and disc. And we're going to talk about a little bit of each of those as we go on in this talk. Currently, our treatment algorithms, if we start least conservative and go to most conservative, include the things you see up here right now: physical therapy, nonsteroidal anti-inflammatory medications, analgesics, corticosteroid injections, biologics like viscosupplementation, and then, of course, surgery. Prolotherapy and things of that sort would be considered regenerative medicine and would fall into that as well, but not necessarily right here. What I want you to realize is the things that are listed right here, they don't address the cause of the problem, do they? And they don't regenerate any tissue. They don't do anything to prevent further damage to the tissue. They certainly don't cure the problem. As a matter of fact, if we look at those treatments and we look at the American Academy of Orthopedic Surgeons website and we look at what their treatment recommendations are based on current evidence-based medicine, you'll see, for example, under recommendation 8 on the board on the screen in front of you, that there's inconclusive evidence to support the use of intra-articular corticosteroids. Well, that's interesting. That's one of our mainstays of treatment, isn't it? There's strong evidence against the use of viscosupplementation for the treatment of osteoarthritis of the knee. There's actually strong evidence against the use of irrigation and lavage, arthroscopic treatment for the treatment of osteoarthritis of the knee. Well, wait a minute. If there's not good evidence in support of all these things that we're doing, what do we...
With USF and this academy will be multiple modules that go through basic cell science, laboratory techniques, and acquaint you with what is proper so that actually you can be better consumers of what you're being told is proper and what works. And then we will take you into the clinic, show you how to properly extract tissue from patients that can be isolated into different cell types, and then we will provide our resources for you that you may want to take advantage of in terms of referrals outside the U.S. where good, sound, responsible clinical work is being done. The cell scientists that we are privileged to work with at Da Vinci Biosciences and DV Biologics, where you can get true access to cellular expertise, and then the faculty of subspecialists that all have research experience and are all published in their own subspecialties. So hopefully, as you provide what are going to be looked at as very basic treatments in the future, but you know, your patients are going to get these therapies somewhere. Stem cell therapies are becoming more and more promoted, and more patients are having stem cell therapies both inside the U.S. and outside the U.S. And at a very minimum, if you're seeing patients, you want to be able to guide them responsibly to people who are doing reasonable work. In any emerging field, standards don't exactly exist yet, and you can be of great value to your patients to guide them to places that do at least adhere to good science, good protocols, and responsible treatments. You know, we work with, we started out 8 years ago with this being a relatively small field, with those of us who were willing to do the clinical translation of adult stem cells, and we will be having an expert faculty of people with years of experience. So patients are seeking alternatives to traditional pharmaceutical models for these chronic degenerative diseases that you hear about, and we at this academy at least have the philosophy that diseases are not pill deficiencies. They actually are an imbalance that can be defined and possibly corrected, and this is just one more tool that enables us to be helpful to our patients. So many patients now are seeking more natural options. We're getting a more and more educated public, a more and more discerning public.
Thank you, Jared. So as you may imagine, or you may have noticed from the program, there was a miscommunication in the scheduling of my talk. And so thank you, Jared, for being so gracious to allow me your time. I think you'll follow me. So we'll go ahead and get started, because originally on the program I had 45 minutes. I'm going to give you a 45-minute talk in half an hour. In the way of full disclosure, I'm a founder and chief science officer of Neogenis Labs, a nitric oxide-based company out of the University of Texas, and have done some consulting for a number of pharmaceutical companies. This one? Okay. So I'm going to spend just a little bit of time putting us on the same page of really providing a definition for regenerative medicine, stem cell biology, because I'm not an expert in stem cell biology. I've spent the past 15 years of my academic career studying the control and production of nitric oxide. But now, as we enter this age of regenerative medicine and stem cell therapy, what we've learned is that nitric oxide is critical for not only our body's own ability to mobilize and differentiate our own stem cells, but also predict how well stem cell therapies actually worked, both in post-infarct patients at Texas Heart Institute, where they do a lot of stem cell therapy, and post-infarct patients. But what I'm going to spend the majority of the time on is really giving you a firm understanding of nitric oxide and provide you with hopefully some education on how you can differentiate different nitric oxide strategies that are available to you in the marketplace and be able to discriminate between really good science versus creative marketing. And I don't have to tell you guys this, but I'm trained as a biochemist and physiologist, and when we look at, I'm trained as a drug discovery chemist, but really good, and in what we use in the Western world is really applied pharmacology, which I think is bad medicine. So if we can restore these physiological and biochemical pathways, then that's what nature intended us to do, and I think that's good medicine. We know we do miserably, horribly at managing chronic disease here in the U.S. It's responsible for 61% of the deaths worldwide, and it's a compliance issue, but we know that these are modifiable by diet and lifestyle, so that people don't eat the amount of food they're supposed to, or the right foods, and we don't get the right amount of physical exercise. And so at the end of this 30 minutes, what I hope to convince you of is that the single molecular mechanism of action of a good diet, moderate physical exercise, revolves around the production of a single molecule called nitric oxide. And this is just really a definition